Have you ever taken medicine for your pain and it comes back after some time? What if I tell you that the pain that you are suffering is not only in your body? What if I tell you that your pain has a story, and this is the right time that you listen to your body and listen to the story that the body is telling you. Hi, I'm Dr. Hasina. I'm a pain specialist, and for years I had been treating chronic pain. I observed that once I treat my patients, let's say someone comes with shoulder pain, I treat with medicines or injectables or interventions in some cases. Either the patient comes up after some time, say 3 to 6 months, with the same pain, or there is another pain which is started in the body, and the process of taking medicines and interventions, it starts again. It was at that time I started to study chronic pain deeply in order to understand what is happening. Why is the body is not healing? Why is it not going away? Why the patient is coming again and again, sometimes with the same pain and sometimes with altogether different pains. Conventionally, we as doctors, we are taught to treat the pain just physically. If someone has a disc prolapse, treat that symptom. If someone has a frozen shoulder, treat that symptom with medicines or interventions, and the pain temporarily goes away. But chronic pain, it's different. It acts differently. Chronic pain is often amalgam of chronic stresses, chronic strains, unprocessed emotions, past traumas. So until and unless you don't take care of that, the patient is always coming back to you, is going to come back to you again and again with either the same problem or quite different problem in the body. So until and unless you don't take care of that aspect, the pain is not going to go away. There is a completely different neuroscience behind the chronic pain. If there is an injury in the body and that leads to pain, over time there is oversensitization of the nervous system and there is over modulation of neurons in the brain. So if there is an injury and it's processed in the nervous system or in the brain, if it's not cured early, there is oversensitization of the nervous system and the pain lingers on for a very long time. So chronic pain requires a multi-dimensional approach. It's not going to go away just by taking pills. Chronic pain requires physiotherapy, the right kind of movements, taking care of the emotions, the unprocessed emotions, taking care of the stress, and it requires you to change some bad habits and introduce good habits in your body. It requires the relaxation of the brain and the nervous system and to put the hormones in the good way. So I, as a pain specialist, I firmly believe that treating chronic pain, there should be a holistic approach to it. In my practice, I use the ARC method, the awareness, reconnection and change method. We help the patient to get aware about the pain. It's origin, when did it started, when it's worse, when it gets decreased, or what are the exaggerating factors, what are the relieving factors. And then we help the patient to reconnect with the body. If you are someone suffering from chronic pain, just realize and just listen that your pain is real. I know it's constant, it's always there, it's not going away, but it's real. And it needs a holistic approach to address this and to get rid of this. Pain is not just a signal from the body. It's something which is going deep within. And healing begins when we start listening. When we start listening to the story that your body has been telling you for a very long time. If you are someone who is suffering from chronic pain, or if you love someone who is suffering from chronic pain, then subscribe to this channel and follow this channel, as we are going to learn holistic approach to chronic pain. This is an education channel, and whatever information I'll be giving you is for educational purposes only, and in no way it will replace the treatment. It cannot replace the treatments which are prescribed to you by a physician. You'll have to continue with that.